And I would say there are these two challenges. One of the technical challenges that we've gone through. The second are the societal challenges. And they range from the things in the participatory realm to a whole variety of other things that deal with ethics and legality and confidentiality about information and so forth. And I'll argue that it's the societal challenges that are going to be the gating influence on how fast P4 medicine really comes to the fore. And one of the really interesting questions is how can we accelerate this process? Now, another point I want to make about P4 medicine is that it is a terribly complicated problem which requires an integrated research attack, and I call that big science. That is, you have to take a coordinated, integrated effort to take on some of these P4 medicine problems. Small science can do interesting bits and pieces, and the integration of these two is really essential. But what I really mean by big science is this vision-driven, integrated, cross-disciplinary big science that we've begun to practice at ISB, because through its democratization of systems approaches, it enormously enriches the potential for taking on big problems. And P4 medicine is just one of the big problems that we're going to be actually talking about. Now, the Institute for Systems Biology, as far as philosophy goes, certainly is interested in science and technology and computation and mathematics, but it also has a deep commitment in transferring knowledge to society. And we've done that in two major ways. One, we have a set of 8 people who work full-time on K through 12 education, taking a systems approach to education. And we've really transformed K through 12 science education in the Seattle School District. I'd be glad to talk with anyone who's interested in that later. The second thing that we're interested in is transferring our IP to society, and we do that generally through the creation of companies. So ISB, since its inception, has created 5 companies. They're all going extremely well. One of those companies is called the Accelerator, and that's a company that's set up to create other companies, a joint venture with 5 venture capital groups. And we've created, in the last 6 years, about 13 companies, of which 9 are doing very well from that endeavor. And again, we could talk about that. What I'd really like to talk about is the final point that is a part of our philosophy, and that is big problems in science really require the deployment of strategic partners. And that's true for a lot of reasons. You need a complementarity of skills and technology. In many cases, you need to create materials, patient materials, and things like that. But from my point of view, most important is strategic partners, particularly international ones, create completely new approaches to fundraising. And I can say we would never have gotten the resources to do what we've done for P4 medicine from the US federal government, from NIH or NSF. The grants they give out are small compared to what you need for big science. So how did we go about setting up strategic partnerships? Well, one strategic partnership we've set up is with the state of Luxembourg. We're doing a number of things for them. In return, they've given us $100 million over 5 years to take on 2 of the most fundamental problems in P4 medicine, and a lot of the things I talked about here came from those kind of studies. They've enabled a real revolution in medicine by that kind of commitment. And point number 2 is we've created a nonprofit called the P4 Medicine Institute, which is committed to helping ISB create a small and focused network of clinical centers that will deploy ISB clinical assays in pilot projects and will use the pilot projects to prove the power of P4 medicine to the skeptics. And Ohio State was our first partner, and we're setting up now pilot projects in wellness and in heart failure. And a second partner has recently joined a community hospital in the Northwest called Peace Health, and we're just negotiating what the pilot projects will be. Our vision is to acquire of the order of 6 of these clinical partners and push of the order of 12 to 15 pilot projects to deploy many of the different resources that we skipped over so quickly. So the P4 Medicine Institute then is all about creating this network and then enabling best practice from the network to be spread across. And it's also about really hiring consultants that will let us take on some of the societal challenges of P4 medicine. For example, we're really talking with some first-rate economists about the possibility of analyzing the economic impact of P4 medicine with regard to turning around the ever-escalating costs of healthcare and so forth. So let me then close with 2 final comments. One, what is P4 medicine going to do for you in as concrete terms as we possibly can make? Number 1, I would say it's going to give us fundamental and deep insight into disease mechanisms, and for a non-responsive populations of patients, that's key for figuring out what drugs you should be deploying. Number 2, it's going to make blood a window into health and disease, exactly as I've described it. Number 3, it's going to let us, in very powerful ways, stratify complex diseases. So one of the things we're very excited about is suppose we can stratify Alzheimer's disease using these iPS cells into 10 categories. What we can do then is go to collectively the drug companies and say, we've stratified Alzheimer's, let's take your 130 drugs and test them against the individual subtypes of Alzheimer's rather than trying to do it in a pooled collective kind of test. Another area that I think is really important is this new approach to drug target discovery. That is, can we have drugs that will disease-perturb networks to make them behave in a more normal fashion? And finally, and I haven't talked about this at all, but this approach allows us to do multi-organ analyses of disease in incredibly powerful ways, integrating dynamically how the organs themselves in a coordinate or disparate way actually respond to the disease. And of course, the last thing is it's going to give us the tools for optimizing wellness. And I just want to say again, emphasizing, wellness is going to be an industry of the future that I predict will far surpass the healthcare industry. And I think the major players in the wellness industry will be entirely different from the major players in the healthcare industry. And the final point I'll leave you with is returning again to what I started with, this theme of complexity. In my view, the challenge for all scientific disciplines and engineering disciplines in the 21st century is complexity. And of course, biology's unique advantage is we have these 4 pillars that allow us to attack complexity in a really effective way. What is interesting about that is if you think about the major societal problems of society, healthcare, global health, the environment, energy, agriculture, nutrition, and on, all of these can be attacked with big science. All of these can be attacked using this systems thinking to these kind of problems. So something for you to think about is, can you create academic institutions that have the right kind of big science that will enable you to really effectively not just address healthcare, but many of these other major problems of concern as well. So with that, I thank you very much for listening. Lots of people have been involved in this process, and I certainly thank all of you. So I'd be glad to take questions if there's any time.